I'm going to talk a little bit, very briefly, about studies in anthropometry in adults, and I'm a pediatrician, as you were just told, so I'll quickly move to children and I'll stay in that space. I'll talk about childhood obesity. I'll walk you through a case study which might make things a little more interesting, a little bit of summary in children and conclusions. So I'm just going to look at the top bit. As you know, with an HbA1c between 5.7 and 6.5, we call it prediabetes, and with a fasting plasma glucose between 100 and 126 and a BP less than between 140 and 200. So you have been hearing this many times today. So after I was given this topic, I actually looked at some of the studies that have been there in adults. And so, like, you know, the earlier panel discussion really set the stage for me, because many times people in India are not willing to, you know, go to a doctor and have their bloods checked. So anthropometry is one very, very easy way by which you can pick up that something is wrong. You can't exactly say that there is prediabetes, but you can, you know, at least advise the patient that he needs to undergo some testing. So there are lots of studies which have looked at general and abdominal obesity, and they've said that there are significant risk factors for some studies say diabetes, but not for prediabetes. But there are others who still say that there is a relationship between increased BMI and the waist-hip ratio. There's a Japanese study which investigated trajectories of BMI and waist circumference in prediabetes, and the rate of increase of BMI. I will come to this again. So the trajectories are extremely important than just what is attained today. So people who actually whose BMI increases rapidly are more likely to develop diabetes, that is more likely to go from pre-diabetes to diabetes. So these are some of the international studies, and if you look at Indian studies, yes, BMI and body fat have been found to be higher, and lean mass has been found to be lower. So we talk a lot about fat, but luckily the panel before me spoke a lot about protein, and unfortunately the lean mass is quite low in Indians, and we have quite a bit of work in it in our institute about it. Now, in a study from South India, it was found that prediabetes was associated with BMI and waist-hip ratio, and the prevalence of prediabetes varied significantly based on BMI. This is from the National Family Health Survey. You must be knowing that the National Family Health Survey, the 5th survey, the data is just out. So if you look at studies in adults, increasing BMI and waist circumference are associated with prediabetes. Higher body fat, lower lean are associated with prediabetes, with increasing prevalence of obesity and adiposity. So adiposity is obviously higher body fat. Prevalence of prediabetes and diabetes increases. Simple tools such as the BMI, waist circumference and body composition may help to screen for prediabetes. And as I said, a longitudinal assessment is always very, very critical. So what about children? You heard some time ago, so many times what happens is you can't start at 45 and 50 when you know that, you know, people are already diabetic or pre-diabetic. And for me, in children, it is very, very important that you teach them a healthy lifestyle, because they are going to go through the whole of life. So, you know, teaching kids to eat properly, good physical activity, not be sedentary, reduce screen time is even more important than teaching it to adults. So we did a study some time ago, I think it was in 2016-17, where we assessed blood sugar, random blood sugar in 14,000 children in 6 different states. And as you can see, we found that the increasing, so obviously in children you have to calculate a Z-score, you cannot use the absolute values. A little child would have a lower BMI than an older child, doesn't mean the older one is overweight. It's just that it has to be age and gender matched. So the BMI Z-scores, you can see, are increasing with the random blood glucose concentrations. So there is an association, we have found it, others have found it. In another of the studies that we did earlier on, we found that, so what essentially we looked at the android and gynoid fat. The android fat implies higher waist circumference or more of abdominal obesity. And as abdominal obesity increased, the fasting insulin levels and the fasting blood glucose went up, the HOMA-IR increased. So these are some of the studies that we have done in the past, and I thought I could just mention some of the results. Now, obesity is a global epidemic in children. If you go to any fairly upper socioeconomic class school or even a middle socioeconomic class school, 20 to 25% children nowadays are overweight or obese, and which is a whopping number. That means 1/4 of the children are either overweight or obese. The World Health Organization has declared that obesity is the most neglected epidemic of modern times. So I'll show you a little bit on this a bit later. So we used to call children malnourished, and a very distinguished speaker before me said that malnourished can be over or under. So we have started calling them malnourished nowadays. Children go to the malls, they eat and drink, they put on weight. So in fact, this was in the times of India. It's not my creation. So the changing lifestyles has put our children at risk. We all know obesity is a lifestyle disorder. Somebody before me also spoke that Indians are prone to central obesity and metabolic syndrome, undernutrition during gestation, low birth weight, the thrifty phenotype. I think Yanik sir has either spoken or will speak. And essentially, whatever is thrown at us, whatever food we have, a lot of it is put away, in fact, for a rainy day, right? This is because of the malnutrition that our generations have suffered before this. This is what has been reported in adults, but our own studies in children, we have shown that higher body fat for a given BMI is seen in Indian children as well. So just like in adults, where the WHO has brought down the Asian BMI for adults, similarly, we have had to bring down the BMI in children because the body fat for a given BMI in an Indian child is higher, just like in an Indian adult. So this is also something that we published. 8 to 10% of children with normal BMI, normal age and gender matched BMI had an increased body fat and abnormal biochemical parameters. We published it in Pediatric Obesity a while ago. So going back to what somebody said, I mean, when we see patients in our OPD, the only thing I can sell to my adolescents is looks. If you say you're not going to look very good, they might agree to eat a little less, and that's the only way. So, as I said, let's just see a case. Let's try to make it a little interesting. So this child came to us in OPD. Do you think she's okay?
No.
She has what one of the distinguished speakers before me just said, a black neck, which we call actually acanthosis nigricans, which shows you that the child has insulin resistance. So this is a 12-year-old girl. Both parents had been diagnosed young with diabetes. You can see the child is hardly 10, 12 years old, so the parents must be how much? Even 28 years older, around 40, not between 35 and 40. So, first thing we always do is look at the height and weight. So this child is 152 centimeters tall and 60 kg in weight. Then of course we looked at her clinical history, we looked at birth history, we looked at feeding history, we looked at age of onset of obesity. We tried to gauge the growth pattern, we looked at family history, and we looked at diet, physical activity, and screen time. So this is what a growth chart looked like. So we used the Indian Academy of Pediatrics growth charts, in which I have been lucky enough to be a part of. So as you can see, with the chart on that side, the chart on the right side, so the one below is the weight and the one on the top is the height. So you can see for the weight, she is very high, around the 95th or 97th percentile. But you can see that she's a tall girl, she's on the 75th percentile. Most children with nutritional obesity are tall. That is the way we actually differentiate a child with hypothyroidism or Cushing's disease or something from what is known as plain nutritional obesity, though it's anything but plain. And the other chart that you see, here we've computed the BMI of the child and you can see it is way above normal. So this BMI is very, very high. So there is also an app that you can actually use for the Indian Academy of Pediatrics growth charts, and her BMI was 26.7, which was way above what is required for her age. Then we of course measured the waist circumference, which we do in all our children, particularly in the overweight children. So this child is 93 centimeters, her waist circumference is 93 centimeters. You can see we plotted it on the waist circumference chart. This is something that we published in 2014. Her fasting blood glucose was 105, PP 156, and HbA1c of 6%. Let me just remind you of her parameters so you can see that she falls in the pre-diabetic range. As far as her waist circumference is concerned, she has very big abdominal obesity. We also measured body fat, it was 45%, and we actually also have published normative body fat values, and as you can see, she's way above the 90th percentile. So she's centrally obese, she's adipose, she has pre-diabetes. That is my diagnosis of this child. So she has childhood obesity and she has pre-diabetes. So what do you do after that? So as somebody said, it has to be an integrated management. It has to be diet, physical activity, lifestyle modification, psychological support, and the very last and the very least is pharmacotherapy. Because like I said, a child is actually going to go through life, so you have to correct the child's lifestyle. For that, you have to correct the parents' lifestyle. So if it has to be a family treatment, you cannot treat the child, you have to treat the family. So in all cases of childhood obesity, it has to be treatment for the family, because whatever the child is not supposed to eat should not come into the house. That's the only way the child will actually stop eating things he's not supposed to eat. So we treated this child with nutritional advice, and we have a multidisciplinary clinic, and all our counselors and everybody, the nutritionist, everybody spoke to her. So at 12 and a half years, her height was 154, she's again grown a couple of centimeters. Weight was 52 kgs, it has come down from 60 to 52. BMI was 21.9, so it has come down significantly. So that is one good thing in children, because they grow. If a child is borderline heavy, you can just hold on to the weight, So as the child grows into his own weight or into her own weight. More likely to happen with him than a her, but still. Her body fat has come down from 45 to 40. Fasting glucose is 98 and 134. So she's just come down below the pre-diabetes. So we again marked her on the app, and as you can see, her parameters have improved a lot. So then what? Happy? Send her home? Forget about her? Never. So continue counseling for diet and physical activity. Remember, this child is going to go to college, and there are going to be people around who are going to be eating McDonald's and God knows what. She's going to want to eat it. So you have to support her through that. You have to support her parents through that. Keep an eye on weight, BMI and waist circumference. Plot growth longitudinally. I cannot, emphasize this enough, that attained or acquired height and weight is not what only you are looking at. You are looking at a longitudinal follow-up, because the trajectories are very, very important. If possible, continue assessment of body composition. So this is not actually her chart. She did quite well, but I'm just showing you this chart to tell you that sometimes, when you're following the child longitudinally, you find that the child who has come down actually goes up much higher than she was before. So longitudinal assessment and not letting the child go, keeping an eye on the child is very, very critical. So if I was to just summarize this case, so please, disregard the dots, I couldn't get them out for some reason. So plotting height, weight, computing BMI and plotting BMI is very, very critical in children. It is even harder to assess these things in children because there are no fixed cutoff. You can't say, okay, 110 centimeters, 6-year-old child is normal or not. If I asked you this question, you would say, oh heavens, I don't know what the normal height and weight is at this age. So it's even harder in children. Remember, under 5 years of age, you have to use the WHO charts, because under 5, those are the charts that have been advised by the Indian government as well as Indian Academy of Pediatrics. Now, for the body mass index, it's a very good marker for obesity and pre-diabetes. It's fairly easy to calculate, especially with your mobile phones. It's a reliable indicator for detection of overweight and obesity in routine clinical practice. But remember, it cannot differentiate between fat and muscle. Though I've put this point down, I'm a little tired of it. Many times people tell me, "Haan, main double body ka hu." I said, get on that XR and I'll tell you how much is your bone and how much is your body fat. So don't believe in that. I would still go with BMI. If it's increasing, I would still be worried. Neha has just told me to wrap it up a little bit faster. So I'll just say here that overweight and obesity in children, the cutoffs are different. Please don't call them 25 and 30 or 23 and 28. No, you can't do that, because if you have a 5-year-old child, a BMI of 24 would be massively obese. Okay? So just remember that the cutoffs are different. Just use a growth chart, and we have also simplified this a little bit. I'll come to that. So after all that we were doing, these charts, those charts, waist circumference, body fat, God knows what have you, we still found that a lot of people don't actually plot children on their BMI chart. So we wrote another paper where we looked at a BMI tool where you only have to plot the height and weight, and you can actually plug the child as underweight, overweight or obese. You do not have to calculate, you do not have to put on the chart you do not have to plot height, weight and BMI separately. So this is a novel tool which we published some time ago. So you can just have the height and weight and you will know whether your child is overweight or obese or not.
Now you have tried, you please explain whatever you can.
Thank you. So I think this is quite simple. So normally we take height and weight, you calculate a BMI, plot the height, plot the weight, plot the BMI. So here what we are just asking you to do is, thank God. So you just, it's not going up. Just give me a second. Fine. Okay, so you just need to, so say you have a child who is 140 centimeters tall. It's a boy, blue is boy, pink is girls, always. So at 140 centimeters, if the child is 60 kilos, then you don't need to plot the height, weight and BMI. You can just plot the 145 and you can plot the 60 kilos and you know that the child is obese. So this has got disconnected for whatever reasons. So what I'm seeing here, I'm not seeing there. Okay. So that is the quick body mass index tool that we published a while ago. We have also, this is doing something very funny. Do you want to operate it for me? Just a second, I'm going to go ahead a little bit. So go to the next slide, please. Next slide, please. One more, next slide, please. One more. Yeah, that's it. So these are the waist circumference charts that we actually published some time ago, and we found that children who had their waist circumference over the 70th centile, they were actually more likely to have pre-diabetes or abnormal lipid parameters. So if you go to the next slide, so this is what we published in the Journal of Pediatrics. Please go to the next slide. Then of course there is a question of estimation of body fat, and I find it's kind of an effective tool to assess body fat and tell the patient and the parents, the child and the parents, how much the body fat is, and when the body, see at the end of the day, if you tell me, madam, your lecture was very good, I'm going to feel very nice. So for the parents, the body fat has gone from 45 to 40. For the child, it's very, very important for us to give them some objective measure. So as you know, there are many ways you can do body fat. So we also have a DEXA, and we also have multiple other, go back one, yes. So, but I find one of the best ones is a bioelectrical impedance, because it's not very expensive, it's occasionally sensitive, and you can actually track the child's body fat percentage quite easily, and needless to say, we have published centiles for those as well. So in boys and girls, the body fat actually, behaves differently. In girls, as you know, at puberty, girls actually acquire more body fat, and in boys, so in fact, this was done by one of my students, and she said, ma'am, something is wrong. I said, what happened? So she said that after 14 years, the body fat has gone down in all boys. So I said, thank God, that's what I expect, because the testosterone comes in and the muscle increases. So this is the boys, and that is the girls. But these charts are also available online. Go to the next one. Then some time ago, we were talking to some pediatricians, and in fact, I was talking to people at Tata Memorial, and there was this thing that, as you know, solid tumors, large tumors, then it's hard to differentiate whether an abnormal BMI is due to the solid tumor or it is because of the excessive weight. So they said, why don't we put together mid-arm circumference? So as you know, traditionally mid-arm circumference is measured for children under 5 years of age, but we have actually put together a multi-center study in which we have published mid-arm circumference to screen for overweight and obesity in 5 to 18-year-old children. So this was the paper that we published, and in fact, this is a twin that came to our OPD, and they were complaining about the little chap. So they told me, इसका तो वजन ही नहीं बढ़ता, देखिए इसको क्या हो गया. I said, ये ठीक है, उसको treatment की जरूरत है. So these are actually twins born of the same birth weight. I don't know why this has happened, but one of them is quite big and the other is not. But we just use the mid-arm circumference tape on these children, and that's why I thought I should show it to you. So as you can see, the lower red dot is where the little guy was, and the one on the top is where the big guy was. So we just used the mid-arm circumference to show that one child was overweight and the other child was alright. So to conclude, increasing BMI and waist circumference are associated with prediabetes in India. Higher body fat and lower lean mass are also associated with prediabetes. I haven't stressed very much on the lean here, but I would really say that, like I have my team has a lot of work in osteoporosis, and many times I say, don't worry about the bone, make sure that the muscle is good. So muscle is one of the most important organs in the body, and if the muscle goes up, the fat goes down, the fat goes up, the muscle goes down. So that's the way it works. So with, low lean mass is associated with prediabetes. With increasing prevalence of obesity and adiposity, prevalence of prediabetes and diabetes are obviously increasing. In children, BMI, body fat and waist circumference are associated with higher blood glucose concentrations. Our and other people's studies have shown this. Pediatric obesity is often neglected but has far-reaching consequences. Apart from anything else, it's the lifestyle which bothers me. You have to teach children to eat well. You cannot send them off to a bariatric surgeon because they will eat their way out of the stapling. Many simple tools such as the BMI, waist circumference, MUAC and body composition may help screen for prediabetes. In children, estimation of height and weight, plotting growth charts and assessing trajectories is critical. I cannot stress enough why it is important to actually plot height and weight. We have diagnosed the world's weirdest things just by plotting the height and weight of the child. So longitudinal trajectory, so every child, whether he is a little one or a child who is growing till 18 years, should have a growth chart. Early screening and preventive measures at school and community level are absolutely essential to control obesity and the other side of the coin, prediabetes. Thank you.